What are your views on doing the AHA, not just the AHA, but the BLSs and the ACLS and ITLS? Is it every 2 years now?
Every
Yeah,
two
every
years.
2 years. What are your views on that? Is it good? Is it bad?
I guess, the thing is that I think it's generalized for everyone, but I don't think it should be. For some people that are clinically involved or do higher call volumes, I don't think it's as pertinent or it's as valuable. But for some people that work in isolated environments, I think it's very important because you might go 6 to 8 weeks without seeing a patient, especially if you're doing long contracts or whatever form of work that you're doing where you don't see patients. I think it's very important for refreshing your knowledge and just getting hands on and making sure that quality assurance, yes, ticks it, you are ready and you can perform these skills. I think BLS for a paramedic, I don't think it's as valuable for a paramedic. I just feel like the ACLS maybe. But also, like for instance, there's like if you are a paramedic in London, for instance, it's very few skills on the ACLS that you do. So I'm not sure how valuable it becomes. It's valuable for the insight, but for the practical part of things, it's not really as valuable because you don't get to apply most of those skills as much as others. I guess in cardiac arrest, but in terms of the other skills that come on the ACLS course, you don't really apply most of them, or at least you don't practice most of them. At least that's what I think.
Okay. Before I share my views, Melusi, what are yours?
I'll tell you, my lecturer used to say they were a money-making scheme. He used to say they were not necessary. Funny enough, he was teaching them too. He was teaching them.
Not but I have to make. I have a
Yeah,
wallet that has a lot of space.
yeah, he used to teach them at night, teach doctors how to do those things. And they used to be fascinated. Our lecturer is teaching doctors, But then we got to work and to do those courses too, and then to understand, oh, this is actually like this. It's set. It's like this. But I think there is value, as you said, Elias. If you do the types of cases that you learn about there frequently, then you don't really need to do a lot of these studies because you practice this thing. But now we know that if you don't use your knowledge, you get a bit rusty. If you don't think about it, you get a bit rusty. My the way that I was interpreting ECGs when I was back in South Africa is comparing to here is a bit different. It's changed because there is very limited that you're expected to do. So I focus on that, But not that I don't know it, but I've forgotten it because I don't use it a lot.